The federal government has assured Nigerians that there is no need for panic despite being in the third wave of the coronavirus pandemic. Director General of the Nigerian Center for Disease Control, NCDC, Chikwe Ekwazu, gave the assurance during the weekly COVID-19 press briefing at the State House in Abuja. The DG says although the country has been recording Delta variant cases in the past weeks, the center has better knowledge of handling the situation compared to the first and second wave. Our correspondent, Abisola Adebayo, has the details.
In the wake of the emergence of the third wave of the COVID-19 pandemic, the federal government says Nigeria is beginning to experience a situation where the Delta variant is spreading at an alarming rate and tearing through the country's unvaccinated populations. Minister of Health, Osage Ehanire, says the government is worried because the variant is more transmissible and dangerous.
The country is particularly concerned about the Delta variant because it is much more transmissible. It has been estimated to be 60% more transmissible, which means that where one virus of the previous variants will infect 100 people, this particular one will infect 160 people. That's a lot. Secondly, this variant is also of concern because it affects even younger people. Before now, we did say that younger people would largely get away unscathed from the infection, and we pegged the vaccination from 18 years upwards. But this Delta variant attacks people, and remember, we also did say that those who suffered most from the COVID-19 were those who had underlying ailments. But this variant seems to care less. It does not discriminate too much.
To tackle the situation, the federal government says vaccination rollout is starting in earnest and all efforts are in place to ensure the government acquires more vaccine.
I want to assure Nigerians that we're on track to flag off the next phase of the COVID-19 vaccine rollout next week, Monday. We're also expecting the AstraZeneca vaccine. Our plan is that for those who have gotten the first dose of the AstraZeneca vaccine during the first phase, there will be doses available to take their second shots in the next few weeks. Please make sure that you take the AstraZeneca vaccine if that is what you took for the first dose. If you took first dose as AstraZeneca, please take the second dose as AstraZeneca. And if you're going to take Moderna as your first dose, also take it as your second dose.
Meanwhile, the Nigerian Center for Disease Control says the situation is under control as the center is equipped with enough experience from the first and second phases.
We are not where we were in the first or second. We know more, we have more tools, and we're more determined than ever before. We have our warehouses are full of laboratory tests. We're supporting the states to use this. We're thinking of different methods to increase access through whatever program is already existing in the states. So by detecting more, we're able to respond, and the states have done an incredibly good job, most states, in scaling up not just the lab capacity, which is something we talk about all the time, but sustaining the people that are collecting these samples. And I really want to give credit to public health workers at the state level.
Amid this, the federal government has assured Nigerians that a lockdown is not an option right now because doing so would stifle the economy and restrict people's freedom. Abisola Adebayo, TV 360, Lagos.